After cesarean section, recovery may take time, okay, but there are ways that can support your healing faster and also prevent complications. So in this video today, I'll be giving you tips, ways that can help you recover from your cesarean section faster, okay? Number one is you should walk as soon as your healthcare provider has advised you to do that. Okay, because you have done CS doesn't mean that you should lie on the bed all day or all the time. The moment your healthcare provider said, Madam, you can now move around, you can now walk around, please always leave that bed and take short walks, not strenuous ones, short walks for now. Okay, now this will help to improve circulation, prevent blood clot, and also help your bowel movement to return. That it will help you to go to the toilet, preventing constipation as well. Okay, but to take your pain medication, yes, don't pretend, don't try to endure the pain. There is no point for that. Now, when you take your pain medication, you'll be able to move. That is, you'll be able to walk around, leave the bed. It will also help you to sleep and also take care of your baby more comfortable. All right. Number 3, please, if your doctor has said that you cannot eat and drink, ensure you take enough water. Stay hydrated, okay? Eat foods that are rich in protein, iron, vegetables, fruits, fibers. Now, all these foods, they are going to enhance healing and also prevent constipation. Number 4, you see that your incision side, that place that they cut and open, please always support it with pillow or use a thick towel to support it whenever you are coughing, you're laughing, or you're trying to move. Support it, support that area, okay? Number 5, please avoid heavy lifting. For now, like the recommendation said, I should not lift anything that is heavier than your baby. Okay. Number 6, please avoid constipation by all means. This is why you need to take enough water, eat more of fruits and veggies, those foods that are high in fibers. Eat them because they will also help to prevent constipation. And like I said, move around, because if you consistently lie on the bed, it can increase your risk of having constipation. Number 7, you see that your incision site again, that place that they cut and open, please prevent it from any form of infection. Always keep it clean and dry. Okay, don't let it become infected. Always follow the instruction of your healthcare provider on wound care, on how you're going to take care of it. Okay. Number 8, because you're asked to leave the bed and move around after CS section doesn't mean you should not rest. You should also rest as much as possible. Okay. Sleep when you can and also accept help from your loved ones. Don't show us that you're a superwoman. You need rest, because that will also help you to recover faster. All right. Latest questions you should be able to ask as a pregnant woman whenever you go for your scan. It is always advisable whenever you go for your series of scans, feel free to ask questions, especially if you want to know what is going on with your pregnancy. Now, if you're not able to ask the sonographer, when you take the results to your healthcare provider, you can always ask your healthcare provider these questions. Number 1, you should ask for the general well-being of your baby in the womb. How is the baby? Is the baby okay? Is there any abnormality anywhere? Is there anything that should be a concern to you? You should be able to ask. And if there is any, they will always let you know. But 2, ask for the position, the location of the placenta. Is it anterior? Is it posterior? Is it low-lying? If it is a low-lying placenta, that is a concern, okay? Ask your healthcare provider the things you should stop doing at this point if the placenta is low-lying, the next step to take, just ask. But if it is anterior and a posterior position, it is not a problem. But low-lying, you should ask for that question. What is involved, the things you should stop doing, just to prevent any further complications. So, number 3, you should ask for the heartbeat of your baby. How is the heartbeat of your baby? Is it normal? Is it abnormal? If it is not normal, if it is normal, they will tell you. Okay. The next question you should ask about the quantity of your amniotic fluid. That fluid that surrounds your baby in the womb. It should be normal. It shouldn't be low. It shouldn't be much. It should just be at the normal range. So you should ask your healthcare provider, have that amniotic fluid. Okay, so one question you should ask about how far along is the pregnancy. You're asking for the gestational age of your pregnancy. Now, when you ask and they tell you, be able to compare it with whatever gestational age you had in your mind before. Okay, now gestational age just gives you an estimate of how many weeks and days is your pregnancy. Also ask about the estimated date of your delivery, but you should know that EDD is just an estimate. It doesn't mean that the baby will arrive that day. Most babies do not arrive on that day. Okay, it's just for you to know, and especially when that day is approaching, when you begin to get yourself prepared and ready, even if it won't happen on that day. Okay, now if it is during the early weeks of pregnancy, it is your first scan you're running during your pregnancy, you should be able to ask the healthcare provider the position of the baby. Is the baby positioned accurately? Also ask how many babies are in there. You should be able to know. All right, so these are vital questions you should ask whenever you go for your scan during pregnancy.